Hi everybody, Neil Kravitz here. For this clinical pearl, I want to walk you through how I prepare an orthognathic surgical case. I just had a surgical patient in the chair and we did this technique on her study models. So what I like to do is take study model impressions, I'll do that the appointment before, and then I'll pour them up. And then I will go to the lab and see if I have any interferences. And a lot of times the interferences will be on those plunging palatal cusps of the maxillary premolars. Oftentimes the mandibular second molars will have torque issues. And then I will see where the model is rocking. I'll actually even take the model and put pressure on it with my hands. And then when I open up the model, I'll see the indentations in the stone. And then I will take the acrylic burr and I will reduce the interferences. Now, just because I'm reducing the interferences on the stone model doesn't mean I'm going to do that amount of equilibration in the chair, but I want to eliminate the interferences. I will take then a Sharpie marker and then highlight the areas that I equilibrated. So here you can see I equilibrated the palatal cusp of the upper left 6. I also had a marginal ridge discrepancy on the premolar. And then I will test the occlusion and see if it is rocking. Okay, and here we don't have any rocking. Actually, everything is socked in really nicely. We're actually already prepared for orthognathic surgery. You can also use these models and look from the inside and see if there are any cuspal interferences that are causing the models to rock. Okay, if they are rocking, we want to reduce that stone model. And then I will take the stone model with the Sharpie highlights, and then I now know which teeth I need to do finishing bends. So for example, I could do a little bit of palatal cusp enameloplasty on the upper left 6, but I could also just do a step-up bend on the upper left 5. And I will take this model to the chair and do the adjustment in the chair. I will repeat this appointment 2 or 3 times prior to the patient having orthognathic surgery. Now, why do I do this? One, if the teeth sock in perfectly well, which is my goal, it makes the surgery easy. It minimizes the need for that surgical splint or long-term use of that surgical splint. And also it prevents the orthognathic surgeon from having to do heavy enameloplasty. When they do their 3D treatment planning software, if you have interferences, it will show up on the software. And the surgeon will use that guide and simply do heavy enameloplasty during surgery. And if I can avoid that by doing finishing bends or doing minor enameloplasty in my office beforehand, it makes everything easier. So in review, what I do prior to orthognathic surgery is I take a stone model impression. I see where my interferences are. There's always the few hot spots that are very similar, the upper premolars, the upper molars, the palatal cusps on the upper, the lower second molar. And I'll see where I need to do model enameloplasty. I will make adjustments in the model with the acrylic burr. I will highlight those areas with a Sharpie marker. Then I will take those stone models to the chair to do the finishing bends or the chair side enameloplasty. And then I will repeat this appointment at least 1 more time, but if I could do it 2 times, that would be great. And then the patient's ready for surgery. Post-surgery, there's very minimal work that I have to do. Primarily, I'm just adjusting the elastics to make sure those midlines are perfect. Give this a shot. Let me know what you think. Thank you guys so much for subscribing to this page. Thank you for supporting the JCO.